C'est le cas d'Elsevier, qui propose différentes solutions cliniques. On sait que c'est une décision très stratégique pour ces grands acteurs, parce que ça a beaucoup d'implications. Et donc pour en parler, on a la chance d'avoir avec nous du Royaume-Uni le vice-président de Health Informatics d'Elsevier Clinical Solutions, avec plus de 30 ans d'expérience dans l'intégration de solutions dans les systèmes d'information hospitaliers et de dossiers médicaux informatisés. J'invite tout de suite sur le plateau, à distance, depuis le Royaume-Uni, je crois, Robert Nieves.
Hi, should I start?
Hello, Robert. How are you?
Hey, how are you?
Fine, and you?
I'm good, thank you.
So, could you explain to all our attendees what is Elsevier and what do you do at Elsevier?
Great, I will. I will show you on my screen. I have a couple of slides to talk about Elsevier.
We see your screen. It's okay.
Yeah. If you know Elsevier, you know us as a publisher. We have a 140-year history publishing health and life sciences related content. We're in fact the world's largest publisher of that type of content. So if you know us because of the books that we publish, the journals that we publish, and that history. We are a global company. We have offices in over 66 locations across the world, in 24 countries. Our staff is about over 7,500 individuals that make up the Elsevier team. And we work mainly with universities and schools. We work with hospital systems, et cetera. From a clinical decision support perspective, because we are a publisher of evidence-based content, one of the key objectives that we have is for us to be able to take that scientific knowledge, that published knowledge, those best practices, and bring that information to the clinicians at the bedside in order to impact care, a true clinical decision support based off of the latest evidence, based off the latest practices. So how do we do that? How do we go from publications, books, and journals to the bedside is through some clinical decision support solutions that we provide. The example that I want to talk to you today about is the care planning solution that we provide, because it's one of them that we've been utilizing SNOMED CT, and I want to walk you through the example of how we're utilizing SNOMED CT within our solutions. But we provide a whole host of different solutions with that central idea of bringing evidence and best practices to the bedside clinician in order to make better decisions when we're impacting care. The reason for that and why it's so important is that we know that we have problems in healthcare globally. We know that as clinicians, we sometimes cause harm to our patients because of a lot of the different variability that happens when we're caring for patients. And so it's very easy for us to make a mistake. We're human, we get tired, we take care of a lot of patients, and it's easy for us to make errors. And so we need, as clinicians, we need the tools to support us to deliver the best care. So reducing errors, ensuring safety by bringing standardized practices, bringing evidence to the bedside is what we're after from an Elsevier perspective. Now, we've been working from a care planning perspective. This solution has been around for close to 40 years. And the intent of it was to look at the care planning process, the process for planning care for a patient, and looked at how can we make that process better? How can we make it valuable for nurses and for the interdisciplinary team that do that process every day for every patient. And so we looked at how do we bring that evidence in a way that is usable into that care planning process, and that's what we started working on. we developed our care plans based off of ensuring that it supports the clinical practice of the different team members. Early on in our history with care planning, we had to begin working with electronic health providers, electronic health record vendors, because that was where the future was, right? And so we started developing the content in an actionable format, in a database, that we can then take our content and bring it into the EHRs where the clinicians would utilize our care plans and document to the care plans as an example. So it's an actionable content, if you will, that gets brought into the EHRs. Very early on, we worked with vendors like Allscripts or Eclipses back then. We are a partner of Epic. We're a partner of Cerner. We have done now over 17 different partnerships with different electronic health record providers across the world, where we bring and take our content and put it into the electronic health record where the clinicians are utilizing that content. And so it's really important that in order to do that, that we provide the content in a very structured and normalized way and establish a content interoperability structure to make all of this work. So in the history, we've learned how to do that more and better and better and better. Now, from a SNOMED CT perspective, about 5 years ago, we started looking at our content, the content that we author and we provide for care planning in this example. And we started looking at the how do we standardize and ensure that there was interoperability, if you will, of the content. The reason for that was that we started getting requests from our clients. We have over 400 hospitals that utilize our care plans in Epic as an example. But they started asking us about, can we map our content to standardized terminologies to facilitate investigations and reports? So we started, the request came from our clients. And then we also started talking to universities. There was a number of different schools of nursing that were looking to do studies. And what they found was that, what one organization put into their electronic health record was very different than what another organization built into their electronic health record, their Epic systems. And they were having a hard time comparing to do studies. So they put together a big data conference group of vendors like Elsevier, electronic health providers like Epic, and professors from schools to come together and look at, how can we make the content much more interoperable, as well as be able to do the studies, and compare. So that was the second reason that we started looking at how do we take our content and map it to standardized terminologies. The third reason was internal to Elsevier. We are always looking at how do we make the process easier and facilitate that process, especially when we have now care plans not only in English, but also in British English, Australian English, Spanish, Portuguese. And so we needed to look at our infrastructure and look at how we were setting up our content to achieve that interoperability. So what we did was that we mapped our content, in this example, the care planning content, to SNOMED CT. That's one of the terminologies that we map to. Now, when we map it at all the different levels of the content that create a care plan in this example. So the title level of the care plan is coded to SNOMED CT. The problem level of the care plan, in this case, the infection level, that's coded to SNOMED CT. The interventions or the goals, the clinical goals are also coded to SNOMED CT, as well as the interventions are coded to SNOMED CT. And finally, the education goals on what we need to teach the patient about is coded to SNOMED CT. So what we did was that we took our structured relational database of content for care plans, and we mapped all of the different levels to SNOMED CT. And now we provide, as part of our content, not only the Elsevier content of care plans, but also the mappings to the terminologies. And so what we're able to do then is when we import our content from our database into the different electronic health records, in our import files, we include the terminologies and this example of SNOMED CT to facilitate that import. Other uses from this, from mapping the content to use within the electronic health records, is that with the codes, we can facilitate the suggestion of care plans based off of what a physician is entering as a problem. And so it facilitates the use of clinical decision support rules to facilitate the whole care planning process. So we've been very successful with that, along with establishing that content infrastructure that's normalized, structured, and mapped to terminologies. So that's just a very brief summary of what we are doing from an Elsevier perspective in this journey of interoperability, if you will, as well as the standard terminologies. From a care planning perspective, our care planning solution has won the best in class for clinical decision support for order sets and care planning the last 4 years in a row. So we've been very successful in this area. And again, that just gives you an example of how we're looking at, content. Again, for us, from an Elsevier perspective, what's important is that we are bringing that scientific knowledge, those best practices, to the clinicians at the bedside.
Thank you. My first question is not really about terminologies, but it's about collaboration. How do you manage the collaboration with large EHR like Cerner and Epic? Because I know that they don't really want to, they always want to do all themselves and don't like really the API, FHIR, and of course, terminologies tools. How do you manage that?
Yeah. So we're in a unique position from an Elsevier perspective because we have the evidence. We have that content that's really important. And it's content that really none of the EHR vendors can truly provide. It would take a huge amount of work effort and resources on their end to replicate what we do, because our expertise is evidence-based publication of content. And so we have that unique position. And because we've structured our content in the way that I laid out with you, we're able to not only deliver the content once, but we're able to update the client's content over and over and over again. Yeah. And so the relationship is really good, and we work very closely. Their expertise is the technology. It's the electronic health record. Our expertise is the content and delivering that content in a way that makes it easy for them to consume and then deliver to their clients. So that's why our relationship is really a good one. Actually, with Epic and with Cerner, Philip Tazi, MV, all of them, we have that really close collaboration because of that, of the content and the respect for their core competency, which is the technology.
Yeah. Back to terminologies, how do you support the clinical practice at the bedside?
Yeah. So one thing, like I said, the one thing is making sure that the clinicians have the right information, right, that's relevant to the care of that patient that they're taking care of. And so, the care planning solution, our order set solution, our patient education solution, when we built it and we leveraged the functionality of the EHRs, the rules engine to deliver the content, it's providing that right information to the clinician when they need it in a usable way. And so that's how we work very closely, not only with the EHR vendors, but with the clients and the clinicians, that are utilizing our solutions. So it's a very tight collaboration between them. But the whole idea is, I'm in the EHR, I'm documenting, I'm taking care of patients. I need to know that information as I'm making decisions, and I need to know the latest information. And so that's how we work it, and that's how we deliver it.
And one final question. If you have to enumerate potential benefits of using this mapping of with the terminology, what are they?
Well, there's definitely many of them, and as more and more, as an informaticist, as we are able to analyze the data more and more value will come from it. But immediately, that ability to be able to compare concepts between organizations is a big one. Working with the University of Minnesota and establishing the recommendations has allowed us to be able to do comparison studies to see what's truly happening. And so that immediate value, that's one immediate value. The second one is, really looking at the use of rules to suggest context relevant information to the clinicians. That happens with terminology. That definitely is facilitated with the use of terminology. So that makes it a lot easier. So those are two big values, right off the bat, amongst many more.
Thanks a lot, Robert, to share all with us. Hope you are well and your family too because of this situation. And I hope next year you can be there with us.
Yes.
Thanks again. See you next year.
Thank you. Thank you.
Et voilà, on arrive.